Ultrasound. We are now finding out that ultrasound carries considerable risk to the fetus. It is used, of course, in to determine birth defects and baby sex, but it's also the fetal monitor, which they put on you when you go to see the doctor. That is an ultrasound. They call it the Doppler, but it's an ultrasound, and it's less powerful than the ones used for birth defects and determining the baby sex, but it is used more frequently. And then if you have a difficult birth, hospital birth, or a C-section, they'll be doing that fetal monitor all the time. The dangers of ultrasound include overheating of the fetus. It heats the skull more rapidly than the soft tissue, subjecting the brain to continued heat after the ultrasound exam. They actually recorded the sound of the ultrasound in the uterus. It sounded as loud as a subway train coming into a station. Frequent exposures associated with a decrease in birth weight, increase in left-handedness, and delayed speech. And we're seeing an epidemic of speech problems today in our babies. Could it be the ultrasound? More dangers. It's focused on babies' genitals to determine the sex. Defects of the genitals are now greatly increased, affecting 1 in 10 babies. It's focused on the heart. Serious defects of the heart have increased 250% in the last, say, 20 years. In 1993, the FDA approved an 8-fold increase in the equipment output. So all of a sudden, women getting the ultrasound tests were subjected to greatly increased exposure. And since that date, the incidence of autism has increased 60-fold. Autism is highest in the very countries where they're doing ultrasound routinely on pregnant women. What to do? First of all, there's no sense doing any ultrasound unless you're prepared to have an abortion if there's something wrong with the baby. Because if you're not prepared to have an abortion, there's no sense doing it. So that's number one. If that's an option for you and you're concerned about birth defects, have one and see what it says. But we've got women going in for frequent ultrasounds, and this is just not good for the baby. My own suggestion is to avoid prenatal screening, ensure a healthy baby with your good diet, and let baby sex be a surprise. A wonderful surprise on birth. Insist on the stethoscope during pregnancy. Don't let them use a fetal monitor to listen to the heartbeat. And avoid a hospital birth if possible. For high-risk mothers, one screening for birth defects may be justified. Okay.